Hi, you guys. I would love to be there in person, but this whole virus has me staying at the office and at home. So my name is Dr. Susie Warden, and I am a chiropractor. You guys' questions are awesome. So what I'm going to do is I'm going to run through why I got into chiropractic, and I'm going to try to answer as many questions through this lecture as we can. And if there still are questions at the end, you guys can email me or ask Miss Brennan, and she can text me or email me, okay? So my education, I have a 4-year degree from Arizona State University. I got my degree in exercise physiology. Love to help people, love to teach people about their body and how to keep in shape and how to have good nutrition, etc. So I got out of school and I really went into corporate wellness, where I had my own business and I would go into corporations and I would teach people how to feel better, what exercises to do, how to lose weight, what nutrition, etc. Because when someone's healthy, it saves their company lots and lots of money with insurance, because if we can keep our employees healthy, they're more productive, they're happier, and they cost less for insurance. So I would go in and develop fitness programs for large numbers of employees, and it was really fun. But people would ask me, well, what happens if my lower back hurts and my knees hurt and this and that? And I knew how to strengthen them, but what beyond that I didn't. And so I always kind of thought chiropractic was a little weird. I thought, oh, it's just different. You know, I was going to school and everybody would go to this chiropractor, and I thought it's kind of weird. But when I got through school, I was working and I met this girl who was my same age, and she had already been through chiropractic school. And so I learned from her what that next level of health could be. And so what she does and what she showed me was how to take an x-ray, and then how from that x-ray we can help everything. So I'm going to kind of go through what that means and teach you guys different areas of the spine and neurologically from the brain, how does it all connect and why does chiropractic help, okay? So let's start with the cervical spine. And I think Mrs. Brennan has a piece of paper, and I'm going to have her attach that. But it has different levels of the spine, from the neck to the middle back to the lower back, and it has areas where those nerves go, and then what symptoms happen if the nerves are irritated getting there, okay? So we'll start with up in the neck, okay? So the neck is called the what spine? Cervical spine. How many segments does it have? It has 7. Okay, so it starts at the base of the head. It has a curve, which is called a lordotic curve. And what happens through bad posture, our head goes forward, and over time, that creates headaches. It creates sinus problems. So I want you guys to look at your chart and go cervical spine. Look at where those nerves go. So very top of that cervical spine, you can see it goes to the head, the eyes, the ears, the nose, the throat, the sinuses. Keep going across your chart. And what symptoms does that create if this area doesn't function well? Guess what? Number 1, number 2, headaches and migraines. Among the cervical spine are headaches, migraines, sinus pressure, ear problems, swallowing, neck pain, numbness and tingling into the fingers, to name a few. So 90, I don't know how many, what's the percentage of population that gets headaches? A lot, okay? I see a lot of them in my office. So I analyze their posture. If the head is forward, that creates this 12 to 15 pound head on top to come forward. When that happens, that lordotic curve straightens out, and it puts a lot of pressure through the bottom part of this spine here, okay? So I'm going to bring this up to us a little bit. So this is the cervical spine. This is the back of the head, okay? This person's facing that way. So you see how curved this is? This is the way it should be, because that's going to keep this head back this way. Right now, when everybody is on their phones more, their computers more, it's just going to set us up for a lot of headaches, a lot of neck problems. And when the head is forward, it also can create tightness and pain between the shoulder blades and all the way down that back, because when that head is forward, all those muscles are trying to pull it back. So the more it's forward, the less we do exercises to do this. Guess what? The more tension's going to be on that neck. These joints don't work right. They don't mobilize correctly. They're not functional. Therefore, we increase our chances of getting all those symptoms on the right of your chart. Okay? So the neck and the cervical spine hold the nerves that go to your head, your eyes, your ears, your nose, your throat, your sinuses, all the way to the tips of your fingers, among many more, okay? All of the nerves to your eyeballs and, throat and mouth, it's all in your neck, okay? So we need to keep that mobilized, and we need to look at the neck first when people come in for headaches. We take an x-ray. What does their neck look like? Is it really straight, and is it forward? In that case, we need to increase posture. We need to do certain things to pull the shoulders back, loosen up the muscles through here, and loosen up the neck and strengthen so that head stays back. So important every day. Look at your parents. Look at you. Is your head forward? One, it's not a good look. Two, it's really bad for your whole entire body, including all the way down your legs. Tight hamstrings, tight calves, and also, forward pressure on those feet are bad too. So cervical spine does a lot. So x-rays of the cervical spine, not always mandatory, but we can look at different orthopedic tests when people come in. Numbness and tingling in their hands, could it be a nerve problem? Yes, it could. Can chiropractic help that? Yes. Another big question was, can you hurt somebody with a chiropractic adjustment? The chances of you getting hurt by a chiropractor are about as high as you getting hit by a meteor, okay? I mean, truly, that's what it is. We take people through extremely careful examinations, and we really isolate where the problem is coming from. If there's any problem with the neck that is going to maybe make us look at not adjusting the person, yeah, sometimes there is. A car accident, a really bad head trauma. Obviously, we have to really analyze, is the spine intact, okay? And if we think that it's not, we x-ray it, we MRI it, we don't touch people. So no, not very often are we ever gonna hurt somebody in our lifetime. In fact, my malpractice insurance is about $5,000 a year, when normal medical doctors, their insurance is somewhat, $25,000 a year. So we don't prescribe medications. That increases the chance of problems too. So we work with our hands, we do very careful examination, and chances are so low that we can hurt somebody. Now, can you be sore? Absolutely. Yes. Can your muscles be sore? Yes, absolutely. But that's a good thing, because it's a good thing when we can engage those muscles and make them do better. Okay, let's move down to the middle back. Middle back is called the thoracic spine. And how many segments does it have? It has 12 segments. It houses the nerves, as you go down your little chart, it houses the nerves to the heart, to the lung, to the spleen, to the pancreas, to the muscles of that lower back. So some of the things that we find when people have middle back pain could be coming from a gallbladder problem. It could be coming from a digestive problem. Could be coming from bad posture. It could be coming from a lot of things. So if you trace your nerves and go from that middle back to where those nerves go, you're gonna see some of the symptoms. Shortness of breath, asthma type symptoms. If we can loosen up this spine, a lot of times people can breathe deeper. Those intercostal muscles work better. A lot of research has shown that adjusting that upper thoracic spine helps with the heart and allowing the heart to decrease blood pressure, actually. So the thoracic spine houses the nerves that go to many organs, but also all of the muscles through that middle back, okay? So another big thing is when people come in from the outside with upper back pain, we look at posture. If people are holding that head forward, all of the pressure from that head going forward is neck and middle back. So again, shoulders back, head back, and we want to hold the head where it's supposed to go. Now the curve in the neck is a lordotic curve. The curve in the middle back is a kyphotic curve. And a lot of people have too much of a kyphosis. That's hyperkyphosis. So we really want to avoid that by always thinking about shoulders back and down, loosening up the muscles of the chest here, and keeping the head back. It goes so many layers deep with health, opening up the lungs, and also it just looks better. What do you think when someone walks into a room with their head all forward? It's sad. Pull your head back, shoulders back, all of a sudden you get energy and you're more happy, okay? So walk into rooms, shoulders back and down. Usually when I'm there, I'm gonna have everybody stand up. We're gonna look at each other as we examine shoulders. Are the shoulders this way or that way? Is the head backwards? Is it forward? Does your knees cave in? Do they come out? It all has to do with how your spine is working, okay? So starting with the head, chin tucks, pull the head back, shoulder retraction, and then pull the shoulders down, okay? So thoracic spine, 12 segments. It has a kyphotic curve normally. It can go hyperkyphotic. That's kind of the humpback, horrible. And then also it houses the nerves that go to the lungs, go to the digestive system. A lot of times we start to adjust the spine in the middle back, and all of a sudden digestion gets better. There's less problems, because as the nerves work better to where they're supposed to go, it just automatically works better. The digestive problems usually aren't from the dysfunction in that back. And by the way, the dysfunction in the back is called a subluxation. Sub meaning under, lux meaning lit. A subluxation is a joint anywhere in the spine or in the extremities, anywhere in the body, that does not move properly. It's not functional and it's out of position. So that can create those nerves not getting to where they're supposed to go and creating the symptoms. So as chiropractors, we look for those joints or the subluxations that aren't moving properly. We move them with the chiropractic adjustment, not scary, very nice and very gentle, and that allows the nerves to work better. Joints move better, lubrication ensues, nerves get to go where they're going. A lot of times it lessens headaches. It lessens all sorts of pain wherever it is. It doesn't necessarily have to be in the spine either. It can be in an elbow. Shoulder can be subluxated. A hip can be subluxated. A toe, an ankle. So chiropractors work on every part of the body. But today we're talking about the central nervous system and how it goes to the muscles and the organs. Okay? So got the middle back. Shoulders back, down, head back. Now, lower back is the lumbar spine. The lumbar spine is 5 segments, and then it attaches to the sacrum and the coccyx. Okay, so let's talk about that lumbar spine. 5 segments. It houses the nerves that go to the lower digestive system, the colon. It goes to the kidneys, the adrenal glands. Very important, because all of those organs are important in daily life. So as you're sitting or you're leaning or you have trauma, a lot of times this lower back takes a beating because of posture, because that head leaning forward too much over time can put pressure on this lower back. People get sciatic problems, okay? That's the lower back pain with it going straight down the middle of your leg and all the way to your, sometimes to your heel. And it's really painful. Chiropractic can help that, because what we do, look at that lower back. We look at the SI joints. I only have one ilium here, one ilia. And so this is the sacrum and ilium. That's kind of where it attaches. Lots of nerves come out there, go through the piriformis of the muscles of that the upper butt area and all the way down that leg. So as we're weaker in our core and too tight in the hip flexors from sitting, lower back pain is inevitable. Gaining weight, lower back pain is inevitable. Bad posture, lower back pain is inevitable. We do not have to take pills for pain, okay? So once somebody finds out that maybe their lower back is in pain, a lot of times the first idea is to take pills, right? So here's my little analogy of, do we really need more pills in our body, or should we try different things? So let's go over the lower back one more time, then we're gonna go over what we do for pain. So lower back, lumbar spine, it's the lordotic curve. It houses the nerves that go to your lower colon, go to your kidneys, go to your adrenal glands, and the nerves go all the way through the lower back down to the legs. So you could feel sciatic pain, which is lower back pain that radiates to your feet from the back. You could feel numbness and tingling. You could feel lower back pain. So those are just some symptoms of this lower back dysfunction, okay? So what do we do about pain? Most people, when you have a headache or you have lower back pain or your shoulder hurts, what are you gonna do? Probably a lot of you would say, take an ibuprofen, take an Advil. Well, every pill you take has some sort of effect on your body, okay? It's usually not natural, and there are a lot of natural anti-inflammatories and natural pain relievers, and we'll get into that. But try this, okay? Think before you take pills, what can we do, okay? So say you wake up with neck pain, okay? How much water have you drank? All right, so let's look at the different things that we can do to avoid pain. And if you do have pain, what can we do? You wake up with neck pain or you wake up with headaches, okay? Instead of taking pills right away, how much water did you drink, okay? Probably not enough. Let's drink some water. That's gonna loosen up the muscles, okay? Let's do some posture exercises, chin tucks, shoulder retraction exercises. Just get that neck moving. You know, maybe stretch out that neck a little bit. Left ear to left shoulder, right ear to right shoulder. Nice and easy, okay? Take some deep breaths. Deep breath in, deep breath out. And a lot of time, you guys, the pain will subside, all right? Right away, just by doing that, all right? Same with the middle back or the lower back. What have I done? You know, did I hurt myself? Maybe you're gonna ice it. Icing it is another big thing. When you immediately find that you have an ankle sprain or neck pain, ice it 10, 15 minutes and then let it be and see if that doesn't help. Because the more pills we take, the more our body doesn't like it. It's chemicals in our body. Are they the worst thing? No, because sometimes we have to. I'm not saying it's bad, but there are other things that we can do without taking pills, okay? So lower back pain, ice it, all right? The other thing is nice and easy, you know? We have what's called a posterior pelvic tilt. You tuck your belly button in and tuck your lower back under. That's gonna help that lower back. Get your posture better. It's gonna take the pressure off your lower back. What are some other things that we can do to keep ourselves healthy? Well, we talked about water. You should be drinking how much water per day? If you said half your body weight in ounces of water, you are correct. Half your body weight. So if you weigh 150 pounds, you have to drink 75 ounces of water. It seems like a lot, but that's the only way to get the toxins and the chemicals out of our body. Our lymphatic system needs that. Picture a water source. Picture a beautiful, pristine river in Montana. What happens if that water dries out? All the fish die, it gets stinky, it's just horrible. That's what we're doing to our body when we don't drink enough water. We're just making the toxins in there that really do want to get out stay in our body. We could start to feel sick because of dehydration. Our muscles tighten up, dehydration. Drink water, drink more water than anything else. Water does not equal coffee. Water does not equal tea. Put things in your water if you have to. Maybe some, fruit or some, lemon or, mint is also good. Okay, so water, half your body weight. We need to eat good. What are the foods that are anti-inflammatory? Lean meats, vegetables, and fruits. Always eat fruits separate because they're sugary. So that's the idea. Drink between meals is another thing. Drink water between your meals, because with your meal you don't want to have extra water, because that's gonna actually decrease your stomach acids and decrease your body's ability to break down the foods that you're eating. So food without water is very important, but water is more important. So if you have to drink with, it's fine. But eating fresh fruits and vegetables, very important. Lean meats. The rest, not so great. Maybe some rice would be brown rice, quinoa, different grains that are better. Okay, a lot of starchy foods like pastas, breads increase are inflammation, which increase pain. So if you know of anybody who has chronic pain, have them look at their diet, because diet plays a huge, huge role in joint pain, whether it's elbows or neck or head or headaches or back pain or foot pain. Huge, huge, huge. What else? Sleep. You need sleep, you guys. Turn off your phones. Actually keep your phones out of the room. All that radiation is killing our cells too. So, you know, sleep 8 hours. You gotta sleep 8 hours every night. Exercise every day. It's something, you know, at least 5 days a week, at least, you know, half hour, 45 minutes. We have time now. Get out, go walk. If you can't get out, up and down the stairs, there's tons of different exercise videos online that you can do. Do not make excuses for these things, you guys. If you want to grow up and you want to be healthy, you want to be successful, you have to feel good. You got to feel good about yourself. You have to feel good about what you're doing. You have to have positivity, and you can conquer anything. But if you're sick, it's tough. And if you're sick, there's so many ways that we can get you healthy. At my office, we not only do chiropractic care, but we have nutrition. I do DNA food sensitivity testing. We have Reiki and craniosacral, which help with the flow of energy. I have an ARP machine, ARP, which helps with chronic pain. Athletes that can't quite get their shoulders better, their knees better, we have a 500 pulses per second stimulation machine that actually increases neurologic input to different areas that help heal athletes and even chronic issues. We have so many different therapies at our office. I have great massage therapists. Everyone gets a massage. Everybody gets some exercises and physical therapy. And what are some other questions that let's see, let's go over these. Let me make sure that I got everything. Let's see, healthy lifestyle, certain groups of people. You know, I see everyone from babies, because actually this is another big question of when should you get your first adjustment? The first big trauma you have is your birth. Okay, so most people aren't getting adjusted at birth, although my kids did and people that are in my office do, because if we can keep this spine mobile, the nerves from your brain going everywhere are more functional, life is healthier. Now apply those pillars of health, we're going to be so healthy. So I see people from newborns to 90-year-old people that just want to feel better. And that what I find is people have pain and they treat it with pills sometimes, and then they figure the pills aren't working and the pills have done bad things to their liver or their kidneys. So if you don't have to take pills, please don't. Go do something natural, because more than likely we can do something natural for it. So, you know, people come in with all different kinds of ailments. Let's see, what's the worst joint or bone formation? I've seen some scoliosis. Scoliosis, you guys, is a lateral curve of the spine. So hyperkyphosis, remember, is the humpback. So that's going to be this. Scoliosis is a rotation of lateral flexion going this way, and sometimes it'll go both ways. So it's a lateral curve of that spine. And I've seen such a bad spine where it's like curved at a 50-degree angle in 2 different places. And this lady probably shrunk 7 or 8 inches over time, never got it fixed. If we can fix things early, we don't have to live like that. It's like, oh my gosh, poor thing. So all we can do at that point, and all we can do where we see people, is get them better from there. I can't reverse it. So the younger you are when you go see a chiropractor, and the more they can work on posture and nutrition and positive mental attitude, it's so huge. What occurs on a daily basis as a chiropractor? Pretty much you saw it. People coming in, me looking at them, taking them through an exam. How far can you turn this way? How far can you turn this way? Let's look at reflexes, different orthopedic tests, and figuring out where their pain is coming from. And then we address that with massage therapy, with chiropractic, with different modalities, maybe ultrasound, maybe some muscle stim or that ARP machine. And then we do physical therapy every day. It's the same thing. Head back, shoulders back, belly button in, butt tight. The other thing I want to make sure you guys get is the book called The Slight Edge. The Slight Edge is a book, and if you start reading it at 16, 17, 18 years old, you will be so much more successful than if you don't. So read it. It's all about what you do on a daily basis that's either good every day or not so good every day. That's either going to turn out great over time or not so good over time. So let's do this. If I chose McDonald's #3 Happy Meal, big guy meal, whatever, every day for the next 20 years, and you chose the grilled chicken with beans, etc. every day, when we're at our 20-year reunion, you're gonna look really good and probably be pretty healthy and successful, because research shows that the healthier you are, the more successful you can be, etc. If you're kind of sick and you're having to really work at it, it's hard to get out in life and do great things when you don't feel good. So in my case, you're gonna feel great and look great and be accomplishing. I'm not, and I'm just not very happy with my life because I chose the McDonald's route and I just didn't exercise and I didn't do anything. You little tiny bits every day, you made good decisions over time with a good attitude, and you never quit. And I don't care. Who cares? Over time, McDonald's. I don't need to exercise. And all of a sudden, I'm overweight. My feet hurt. My legs hurt. I'm taking all sorts of medications because now I'm just trying to cover up my symptoms. So the Slight Edge is going to teach you to be consistent and persistent with everything you do, whether it's health, whether it's school. Just show up for class, do your homework, do it in, day out, little bit. You will be so much more successful than if you don't do it day after day after day after day. Okay? So the Slight Edge, awesome. It's by Jeff Olson. That's another key. A couple more of these. Are you ever scared you might worsen someone's back or neck pain while doing chiropractic? Every once in a while someone comes in and they can't walk. They can't even walk. And so, every once in a while I'm like, oh, it's happened where they lay down on the table, they get all loose, they get relaxed, and then they can't get up. And so, then I have to stim them and ice them, and, so it has happened where, just by their muscles loosening, that, everything loosened and they tried to get up and their joints didn't work right. So it's a process. And sometimes people come in and they haven't taken care of their body for a really long time, so they're really in bad shape. So it takes time. It's like losing weight, it doesn't happen overnight. So everything we do to our body over time adds up to be where you are today. So you have to be careful. Over time, do everything right, okay? Or if you're gonna do something wrong, don't do it for very long. Okay, let's see, what else? The crack that you hear. So the crack that you hear is the release of gases, okay? So when you crack your knuckles, that's release of gases. You do not wanna do that to your neck or your spine. Fingers aren't great either, because the more you move something and it doesn't have to move or mobilize, the more you wear out that joint. So if you adjust your own neck or your back all the time, you're gonna increase the chances that you're gonna get arthritis later. That's not good. So do not adjust your own spine. You come to the chiropractor, okay? And by the way, I'm gonna give you guys, I think I'm gonna sneeze. Excuse me. I'm gonna give you guys coupons or whatever to come in. I don't know how you're gonna get them. But how about this? I'm gonna give you my number and you can call me at the office if you wanna just talk to me about what I do. Hang out with me. I've had lots of students go like, I think I wanna be a physical therapist, or I wanna be a massage therapist, or I'd like to be a chiropractor. Perfect. Come in, love to have you. If you are in some sort of pain, come in, I'd love to help you. If you have more questions, call me. So here's my number. Ready? Get a pen and piece of paper. My number is 630-260-1300. Call me anytime. Dr. Susie Warden. My son Paxton is a sophomore there. And my three older boys went there too. They all played football, all sports, so they've gotten adjusted forever. So I think that's it, you guys. Hopefully, if you guys have questions, please don't hesitate to call me. Or my email is docwarden@msn.com. DOCWARDEN@msn.com. Okay? I know I didn't get to all these, but I think I kind of did for the most part. If I didn't answer your question, give me a call. Okay, you guys, hope you're being safe. Hope you're not going crazy. Please exercise. Posture exercises, because you don't want to come out of here all slumpy. And anyone that needs anything, give me a call. Thank you guys. Bye-bye.